We have been at the Marriott Marquis. We have been at Riverbank State Park. What were we doing in the park? I don't know. But we were in the park. And now we're at the New York Academy of Medicine. And when you think about the history of this distinguished institution and all that it has done with regard to combating racial and ethnic disparities in healthcare, it fits so perfectly with what we're all striving to achieve. It certainly fits perfectly with Aetna's priority to create greater racial and ethnic equality in healthcare. It is certainly central to the mission of AHE, and it is absolutely central to the mission of many of the organizations and individuals that are represented here this evening. And so in many ways, it is absolutely a perfect fit. And so it feels really good to be here this evening. Let me say that it is absolutely a very interesting time to be in the healthcare industry. As many of you know, potentially as soon as tomorrow, the U.S. Supreme Court is going to rule on the constitutionality or lack thereof of the Accountable Care Act. And let me just say, regardless of what the Supreme Court decides, Aetna stands ready to continue in its leadership role of advocating for all communities to have access to affordable, quality health care. So regardless of what the 9 judges decide, we stand ready to continue our work. And we will be guided in that effort by several key principles. One is that we believe that access to affordable and quality health care is a universal issue. Everyone should have access to affordable and quality health care. And the fact that so many people today are still uninsured, and particularly in the Hispanic community, where estimates indicate that about 1/3 of the community is without access to health care, without access to health insurance, in this, the richest country that the world has ever seen, is absolutely disgraceful. And we will do everything that we can in partnership with AHE, with the New York Academy of Medicine, with many of the organizations that are represented here this evening, to do what we can to get more people insured. But it doesn't end there. We also believe very strongly that consumers will increasingly be empowered to make health care decisions, and that consumers will be empowered increasingly through the use of health information technology. And that is something that actually bodes very well for the Hispanic community. I'll touch on that in a moment. So if you are an Aetna member, you already have been benefiting from an incredible array of online tools that make it easier for you to access efficient and effective health care. And many of those tools, by the way, available in Spanish. But even if you're not an Aetna member, increasingly we are making available mobile tools to help all consumers make the right healthcare decisions for themselves. And I'll give you just one example of that, one that I particularly love. Late last year, Aetna bought iTriage. We bought the app and we bought its capabilities. Some of you here in this room may have iTriage. Does anybody have iTriage? Hey, there's some hands, there's some hands, there's some hands, there's some hands. About 10 million people have already downloaded this app. And what it does is that it enables you to research your symptoms. So if something hurts, si algo te duele, and you're not sure what it is, you can put it in iTriage. It'll give you a sense of, hey, you know what, based on what you described, I think you have this. And here are some doctors that you can see that specialize in what ails you. And then, if you want to make an appointment to see that doctor, you can do it too. All with your smartphone. So we are literally putting the power of healthcare decisions in your hands. There's some smartphones. Now, I said before that I think this bodes very well for the Latino community because we tend to over-index in the use of online tools and mobile apps. We love it. So the fact that these tools are being made available, I think, is very much something that's going to benefit us. I don't want to understate in any way the extent of the challenge that we have. We all know that there is a lot of work to do. We also know that through the power of partnership, we can achieve great things, much more than we can achieve on our own. And so certainly, Aetna will continue to look forward to working with AHE, New York Academy of Medicine, many of the organizations represented here today, to make sure that we work toward a day when all communities have access to affordable and quality health care. And so, before I leave you, I wanted to also tee something up. One of the award recipients this evening is actually our chairman and CEO, Mark Bertolini. Now, Mark unfortunately could not be here this evening, but he very much wanted to send a video message. He is very much here in spirit. He is very much at the forefront of pushing for consumers to have the choice and the tools and the information that they need to make appropriate healthcare decisions. And he very much is pushing for health information technology to make healthcare more accessible and affordable to everyone. And so, when I leave, my understanding is that they will tee up his video message. And so, ladies and gentlemen, thank you for your attention. And please continue the great work that you're all doing. And please enjoy the rest of this evening. Thank you very much.
Just to read it is the Association of Hispanic Healthcare Executives, the Healthcare IT Innovator of the Year, presented to Mr. Mark T. Bertolini, Chairman, CEO, and President of Aetna, at our Leaders Advancing Health Equity 12th Annual Healthcare Diversity Awards at the New York Academy of Medicine, June 20th, 2012. Thank you very much.
As you continue to enjoy this lovely evening, and you get ready for the main course, David and I will continue with the awards ceremony. And now I'd like to call in, are you in agreement, David?
I'm in total agreement.
Okay, good. I want to call in Mary Medina. She's the Executive Director for the Center for Trustee Initiatives and Summer Enrichment Program, Greater New York Hospital Association. She'll be presenting the award for the hospital CEO of the Year. Where is Mary? Mary! There's Mary!
Thank you all very much for being here tonight. Can everybody hear me? I know, I'm right there with you. It's hot, you're hungry, and it's a lot of conversation going on. That's a lot of interesting, there are a lot of interesting people here. So one of the things I like to teach everyone that I interact with is know how to keep it succinct, get to the point, and let people network and enjoy themselves. Yeah. So, on behalf of Stanley Brezhnev, a wonderful, truly committed CEO to the area of diversity, I will tell you that he has been a firm supporter of inclusion and diversity. He has been a leader and a pioneer. He has been I tell you, I cannot give enough kudos to Stanley for being one of the first CEOs to embrace the importance of diversity in the boardroom. He was the first one to stand up and say, Mary, with your Greater New York Hospital Association Trustee Initiative, Diversifying Governing Boards, I'm there. With the Summer Enrichment Program, continuing consistently supports the education and the promotion of healthcare executives, I'm there. So on behalf of Stanley Breshnaw, thank you very much, Ahed, for everything you do. And everyone in this room, thank you for supporting diversity, inclusion, education, and addressing healthcare disparities. Enjoy your evening.
All right, so the next honoree is for the Hospital Executive of the Year, and to make the presentation, we're calling up Dr. Miriam Zavala, board member of AHED. Doctor, you there? Can you come on up? By the way, her Spanish is spectacular. Wait till you hear some of it.
Good evening. This award is for the Hospital Executive of the Year. It is my pleasure to introduce to you who's also the president of the Hispanic Nurses Association National in Connecticut, Maria Kroll. Please come up. Maria, Hospital Executive of the Year, RN MSN, Nurse Educator, Bridgeport Hospital School of Nursing, and she's also adjunct at Yale. Leaders Advancing Health Equity, 12th Annual Healthcare Diversity Awards, New York Academy of Medicine, June 20th, 2012. Congratulations.
Thank you very much. I want to thank George and the association for this award. It really is very appreciated. I want to say that since joining the non-association, it has given me so many opportunities to be in touch with students and to help them see how much they, from the beginning of studying, they can do so much to help all those people who don't have a voice in healthcare. So thank you so much, George, and thank you everybody for this award.
And now for our next award, I'd like to bring to the podium Mr. Howard Gold, Senior Vice President, Managed Care, North Shore LIJ Health System. He will be presenting the Hospital Physician of the Year Award to Dr. Jose A. Rodriguez, my doctor. I missed yesterday's appointment. I promise to be a better patient from now on.
Wow. Walked in at that moment. What a terrific evening, isn't this?
Yes.
And what a great association. Thank you very much, Louis, George, the association, for the honor and privilege of being part of this and allowing me and North Shore LIJ to always participate in this organization and help with the work of the organization. Tonight is a great night for us because we are honoring Dr. Jose Rodriguez, our Chief of Anthroplastic Surgery. I knew I would say it wrong. I had it right. I was practicing. I knew I would say it wrong. For being the Doctor of the Year. He's a fantastic doctor. His background as an educator, a scientist, a surgeon is unparalleled in our health system and through the city of New York. He went to Harvard and Columbia and did residencies around the world. He's published in numerous places, and we're very, very proud that he's being recognized tonight. And on behalf of North Shore LIJ and Michael Dowling, our CEO, we're very pleased to give him the award for excellence, patient service, quality of care, and community service. Thank you very much.
As surgeons, we are humbled every day because people come to us and trust us to cut them open. But to be honored and to be recognized by one's own, by los nuestros, is something very special, and I thank you.
I was looking through my iPhone the other day, and I came across his name, and I realized that 10 years ago, he has sent me an email regarding joining AHE. So I said, my God, it's taken me 10 years to get you here, but I'm glad we have. Thank you, doctor.
Now, I'm told to invite you to visit the silent auction in the adjacent chamber, correct? We're still doing that. If you have a chance, take advantage of that. Our next honoree is going to be presenting the award for Community Health Executive of the Year. If I could have Marie Mamouzet, Community Relations Empire Blue Cross Blue Shield, to come on up and help present that award, we would love that.
Substitute. The substitute has just arrived. Pitch hitting for Lou Gehrig.
All right, why don't you introduce yourself?
Good evening, everyone. No, I'm not Marie Mamouzet, but I'm pinch hitting. Errol Pierre, Director of Strategy and Sales Programs at Empire Blue Cross Blue Shield, and very happy to be here. We're excited to be here to support all the work AHE is doing in the community. It's an honor and privilege for me, personally, to introduce our next honoree, Pamela Mattel. With a very brief view of her resume, you'll see she puts the words of her mission statements in action and puts energy and vigor behind the vision of her organization. As the COO of Axia Network, she serves more than 8,000 people daily with the help of 1,300 dedicated employees. She was an active participant on Governor Cuomo's Medicaid redesign team with a focus on health disparities, something that impacts our communities, especially in the Bronx where her organization is located. And even more exciting, her work around primary care and patient-centered medical homes is even a greater focus, which for us at Empire makes us more excited, because if you improve coordination of care with our patients, it increases quality and lowers the cost of care. One thing I will say, Ms. Mattel is actually here with her husband Jim and her 2 sons, so we're actually joining her with an intimate dinner with her family, of 80 of her closest friends. So without further ado, I want to introduce the COO of Axia Network, Pamela Mattel.
Good evening. Good evening. I hope you won't mind. I have a couple of words that I'd like to share with you. First, I'd like to say this is a very special and moving award. It's an honor to be recognized by your own people. It's incredibly humbling to be recognized by another group. In 2004, Raul Rusi and the Honorable Hector Diaz took me out to lunch and shared their vision for a brighter and prosperous Latino community in the South Bronx. They were passionate and clear as they articulated the urgency facing the Latino community. And understandably, they wanted to make sure that I would wholeheartedly support their vision and not drift to other agendas. I remember thinking that I was being invited to participate in a noble pursuit of which I had not been invited before, and such was their gift to me. Our board chairwoman, Milagros Baez O'Toole, also the president of the 100 Hispanic Women and board chairwoman of the Puerto Rican Family Institute, also took me under her wing, and with deep gratitude, I thank them for their leadership, trust, and loyalty, all of which has made me a more effective healthcare leader and a better person. I was raised to believe in the goodness of people and contribute to the well-being of my community. I thank my parents for their guidance, rudeness in the community, and unconditional support. They taught me that equality, fairness, and compassion should guide my choices. Many years ago, I came upon a phrase Gandhi used, which has also been a source of my inspiration: you must be the change that you wish to see in the world. And these values inform my personal and professional life. I would like to take the opportunity also to acknowledge my outstanding husband, Jim, who also dedicated his professional life to the lives of vulnerable students as a school administrator and as a coach. He also has touched the lives of hundreds of young people, making sure that they believe in their potential But even more so, he has been there for me, sacrificing our time together to support me and be an incredible father to our two beautiful sons, Brett and Evan. I've always wanted to work in healthcare, albeit as an adolescent, I thought I should be a veterinarian. However, life presented different opportunities for me, and I shifted to psychology and social work. And over time, two compelling questions continued to present themselves. What makes some people healthy and others unhealthy? And how can we create a society where everyone has a chance to live long, healthy lives? After decades of research, discourse, and advocacy, we've finally come to publicly acknowledge the impact of the social determinants of health. However, people suffering with substance abuse, mental health disorders, and physical health illnesses have known this all along, and they are truly our greatest teachers. On their behalf, we are obligated to integrate education, housing, transportation, agriculture, environment, and language as critically important allies in improving population health. We must be collectively engaged in policymaking, improving social factors, and health services. We need to deepen our understanding of individual behavior and design successful approaches that are culturally and linguistically competent, individualized, and we must invest in the science of biology and genetics to support the shift to prevention and wellness. This award propels me further to devote the time and energy required to create a community where everyone has a chance to live a healthy life. Thank you.
She's got so many of these awards over the last couple of years. She's got to have a whole room dedicated for her. That's the kind of work she does for the community, and it's so great to have her part of it. Our next honoree is for the Managed Care Executive of the Year. If we could have Jason Goh from MetLife to come up and present the award. MetLife, of course, partnering with my favorite teams.